Assalamualaikum. My name is Tahrim Batul and my roll number is the EP 1770168. My group number is 21 and my topic is the sickle cell anemia. Before going to the case study, let's talk about the sickle cell anemia. What is sickle cell anemia? Sickle cell anemia is one of the group of the disorder known as the sickle cell disease. Sickle cell anemia is an inherited red blood cells disorder in which there are not enough healthy red blood cells to carry the oxygen throughout your body. What happened here? Normally, the flexible round RBCs move easily through the blood vessels. In sickle cell anemia, the red blood cells are shaped like the sickles or the crescent moons. These rigid, sticky cells can get stuck in these small blood vessels, which can slow or block the blood flow and oxygen to the parts of the body. Symptoms of the sickle cell anemia usually show up at the young age. They may appear in the babies as early as 4 months but generally occur around the 6 month. There are the different type of the sickle cell disease. They all have similar symptoms which vary in severity. These include the excessive fatigue or irritability from anemia, fussiness in the babies, bad breathing, jaundice, which is the yellowing of the eyes and the skin, swelling, and the pain in the hands and feet, frequent infection, and so on. Type of the sickle cell anemia. Hemoglobin is the protein in the red blood cells that carries the oxygen. It normally has two alpha chain and the two beta chains. The four main types of the sickle cell anemia are caused by different mutations in these genes. Number one is the hemoglobin SS disease. In this, the people who have this form of the sickle cell disease inherit two sickle gene as one from each parent. This is commonly called the sickle cell anemia and is most severe form of the disease. Second is the hemoglobin SC disease. People who have this form of the sickle cell disease inherits a sickle gene S from one parent and from other parent a gene for an abnormal hemoglobin C. This is the milder form of the sickle cell disease. Third one is the hemoglobin beta thalassemia. In this, the people inherit one sickle gene S from one parent and one gene for beta thalassemia and other type of the anemia from the other parent. There are the two types of the beta thalassemia, O and the positive. Those with the hemoglobin S beta O thalassemia usually have a severe form of the sickle cell disease, and people with having the hemoglobin S beta positive thalassemia have the milder form of the sickle cell disease. The hemoglobin S beta 0 thalassemia is more severe. It involves the beta globin gene. It has the similar symptoms to hemoglobin SS anemia. Then we have the hemoglobin SD, hemoglobin SE, and hemoglobin SO. These type of the sickle cell disease are more rare and usually don't have severe symptoms. Sickle cell trait: people who only inherit a mutated gene hemoglobin S from one parent are said to have the sickle cell trait. They may have no symptoms or reduced symptoms. Laboratory evaluation: the people who have inherited the sickle cell gene are diagnosed by electrophoretic procedures that separate the different forms of the hemoglobin. Fetal hemoglobin levels vary among patients. The WBCs and platelet counts are often elevated, but the WBC's differential is normal. The reticulocytes count can range from 5% to 15%, and the MCV, that is the mean corpuscular volume, may be elevated. If the MCV values are within the normal range, the iron deficiency or the beta O thalassemia must be considered. Sickle cells may also be visually observed in poorly oxygenated blood of a patient with sickle cell anemia. In contrast, a patient with a sickle cell trait should have the normal RBC morphology and the WBCs, reticulocytes, and the platelet counts. Sickle cells are rarely observed. In patients with the sickle cell beta 0 thalassemia, hematologic abnormalities vary depending on the amount of the hemoglobin present. This form may be difficult to distinguish from the sickle cell anemia. RBC microcytosis may be the only differentiating parameter. Now move towards the treatment. In treatment and medication, we use the antibiotics to lower the risk of the infection. pain relieving medication, hydroxyurea, decrease the serious complication, reduce the need for the blood transfusions, preventing the sickling of the red blood cells. Ribonucleic reductase inhibitor interferes the growth of the abnormal hemoglobin and produce more fetal hemoglobin. This medication also used for the cancer treatment where it interferes with the growth of the cancer. Then second choice is the blood transfusions and last one is the bone marrow transplant that is very rare. Now move towards the case study. In this, the JT, an 18-year-old man with sickle cell anemia, presented to the emergency department with the chief complaint of the rapid onset of the abdominal pain and shortness of breath. Since infancy, JT has severely incapacitated by his disease. During the early childhood, he experienced several episodes of the acute pain, swelling of the hands and the feet and the joints. 3 years before this admission, JT required a left hip replacement secondary to bony infarctions. Recently, frequent blood transfusions have reduced the frequency of sickling crisis. Physical examination reveals JT has a thin black man in acute distress with sclerosis. He has a pulse of the 110 beats per minute, respiratory rate of the 18 breaths per minute, and the temperature of the 98.6 Fahrenheit. His lungs are clear. Cardiac auscultations reveals a hyperdynamic pericardium and a systolic murmur at the left sternal edge. Splenomegaly is noted, and the chest radiograph reveals only the cardiomegaly. Our CBCs obtained notable results include the following. Here, the hemoglobin is 5.5, that is is lower because the normal range of the hemoglobin is 14 to the 18, and that indicates the anemia. Then SCD, that is the hematocrit that measures the proportions of the RBCs, is 25%. That is normal range is the 42 to 52%, indicates the anemia. WBC's count, that is the 5,000 in normal range, and so on. Let's discuss in the next slides. The subjective, we have the 18-year-old male having the chief complaint rapid onset of the abdominal pain and the shortness of the breath. Medical history is the left hip replacement, blood transfusion, jaundice, acute pain, swelling of the hands and the feet, and the temperature is the 98.6 Fahrenheit. Objective physical examination reveals that the man in the acute distress and with the square stress. What is the square stress? The most often caused by the obstruction of the bile duct, referred to as the jaundice. He has the pulse of the 110 beats per minute, respiratory rate of 18 breaths per minute, temperature is the 98.6 Fahrenheit. Lungs are clear, and the cardiac auscultations reveals a hyperdynamic pericardium and a systolic murmur at the left sternal edge. Splenomegaly is noted, and the chest radiograph reveals only the cardiomegaly. Vital signs: hemoglobin, that is lower, that indicates the anemia. SCT, that is the hematocrit, measures the proportion of the RBCs, is 25%, that is the lower, then indicates the anemia. WBC is 5,000, which within the range, that is 3,200 to 9,800. Platelets count is also in the normals. Reticulocytes is also in within the range. The bilirubin, that is the 5.8, which is higher than its range, so it indicates the hyperbilirubinemia, indicates the jaundice, or also it indicates the liver dysfunction. Then we have the serum creatinine, that is the 3 mg per deciliter. It is also high. Serum creatinine is high. Basically, creatinine is the waste product that is produced by the muscle. It is typically removed through the kidney. So if your kidney function declines, the creatinine levels in the blood rise. They are usually checked with another kidney function marker called the BUN, or the blood urea nitrogen. These tests used together give an indication of the overall kidney function. The people who are dehydrated may have elevated creatinine levels. So it seems that the patient is dehydrated. That's why his creatinine level is high. Second, we have the burn, that is the 52 is also high. The burn test measures the amount of the urea nitrogen found in the blood. As we know that the urea nitrogen is waste product and filtered through the kidney. High value can mean kidney injury or the disease is present, which can be due to the low blood flow to the kidneys caused by the dehydration. Then move towards the assessment. Based on the presence of the splenomegaly and the anemia with target and sickle cell, JT currently is presenting with acute splenic sequestration crisis. Splenomegaly rapidly evolves over the several hours and is accompanied by progressive anemia. The low reticulocyte count is consistent with acute sequestration because a reticulocyte response would be expected. If the anemia had developed in the recent days, jetty inadequate reticulocyte response may reflect rapid progression of anemia. Treatment plan, the JT should be adequately hydrated considering his elevated serum creatinine and the burn. Because patients with sickle cell anemia often lost the ability to concentrate the urine, they may become dehydrated, which further contributes to cell sickling. So first, the patient should be adequately hydrated. Then we use the pain control or pain relieving medications, and should be continued for a few days after hospital discharge. Splenectomy may be indicated in instances of severe splenomegaly. Heparin therapy to prevent the vascular occlusions and the deep vein thrombosis. So that's all for my sides. Thank you.